I'm hot. You want me to go off?
Okay, we are live.
Are we live?
We are live.
Yay, live.
Welcome to Suzilla.
Welcome aboard. It's Suzie and Matt here. Welcome to Tuesday.
Tuesday.
See, I say that we always do our podcast on Tuesday, but Matt says, no, we do it on Thursdays. Like, no, we do it on Tuesday.
We did a long time for Thursdays.
Well, we've done a lot of Tuesdays too. But either way, we try to get one a week.
Well,
this is today's.
We are talking about my favorite subject.
What is your favorite subject?
Dental insurance.
Oh, yay, Team McColm. Yeah, that's me. I'm lucky. I have
bulletproof teeth.
Bulletproof teeth. Yep, that's exactly correct. I have inherited very strong enamel and not that aggressive of plaque.
Yes.
So I've got teeth that will probably last me my entire lifetime if I take care of them, which I've been working on. I've got like 4 fillings total.
Yeah, that's not bad.
They're all in the molars.
Once a decade you might get one.
Yeah, somewhere in that zone. So yeah, not a big deal for me. However, Matt, on the other hand, does not have bulletproof teeth. He's just really proud that he's still got most of his teeth because his father, by this age,
I
mean, by his 40s.
He had everything
dentures.
out.
Yeah, he had a full set of dentures. Sticky teeth, weakish, I don't know, sticky plaque, and enamel that is.
Well, it's not always that.
It's aggressive bacteria.
It's aggressive, what they call sticky plaque.
Yeah.
But he also had poor hygiene.
Yeah, he was also a smoker.
Smoker huge. If you want to keep your teeth, stop smoking.
That does make a difference. There's no question
massive
about
difference.
No question. I mean, all you have to do is have, if you're going to have a tooth removed,
mm-hmm.
one of the things that can happen is a thing called dry socket, and that means the hole that took the whole remaining after they've taken the tooth out isn't healing properly.
Mm-hmm.
I don't know all the details, but we do know that smoking can be a contributor to dry socket.
Yes.
So that's just one good example of how that can really impact your tooth health,
yeah,
oral health.
So yeah, to let you know on how aggressive my mouth environment is.
And he's kissed me, so I know how aggressive it can be.
Yes. So anyway, I brush my teeth at least twice a day.
Yes.
I floss on a fairly regular basis now.
Mm-hmm.
I use a dental rinse.
He uses a fluoride rinse.
Yes.
We make sure that it's got the extra fluoride in it.
Now, still with all that, I had, I woke up Friday. I felt like I got popped in the mouth, and I was like, okay, yeah, rolled over, got smacked. No big deal. By Saturday, I had this big, nasty, infected spot in my mouth, so I had to call my dentist because I was a regular patient of his.
Mm-hmm.
He was kind enough to take have pictures sent to him, have his person talk it out, and we got penicillin sent to me.
Right, because he needed an antibiotic before they could even really do any work on it.
Mm-hmm.
The good news is there's not a lot of pain because we caught it relatively early. The infection's been draining. He's feeling pretty good. We've got an appointment set to clear out the goo, and all will be well. Not everybody can do this.
Correct.
If we had not had dental insurance, then Matt could very well have landed at the urgent care or walk-in clinic begging them for something to take care of this before he could make an appointment with somebody. And then making an appointment is not an easy process if you're not an established patient.
It is horrible. It's one of those crying things. I've had counsel employees more than once on that. A, take care of your teeth, mm-hmm. and B, catch it early.
Yeah, exactly. Well, and the thing is, one thing we also would have possibly run into is not being able to see, especially since we're still in the middle of COVID,
mm-hmm.
is trying to find a provider that would see him at all.
And that's kind of important.
And if you didn't have health insurance, if you didn't have dental insurance,
mm-hmm.
it would have been very, very difficult to find somebody who would take you on.
Well, let's
because you would have been a big cash situation.
The dental insurance. Let's throw out one there. Yeah. If you are an adult with Apple Health,
yes,
you have some dental insurance.
You do.
If someone hasn't said, "Oh, I'm not sure what I've got," drop us a line. We'll look at your account, see what you got, and we will send you the links to the dental insurance page. We will send you the handy dandy. Hey, let's look up to see if I've got a dentist near me.
Finding a dentist that accepts Apple Health for adults can be a little bit of work.
Correct. It takes two to tango.
It does. And it's not the best reimbursement on the dentist's part. So some of them choose to not opt into it.
That's for the adult side.
Right. The kids
are killing it. That's one of the reasons why the kids are all enrolled in the Apple Health program is they've got they've got good reimbursements to the dentist side.
Right. So the dentist is willing to take them on.
And in addition, if you've got a kid that has medical necessity for braces and they're on Apple Health, they can have their teeth done.
Yeah. If you've got your dentist and your orthodontist need to provide proof of medical necessity, and you can get orthodontics taken care of for your kid.
And that's
Apple Health.
Certainly beats my mom having to clean the orthodontics office every week so that she could have braces on me.
Or me just growing up with hoof-angled teeth.
Yeah.
Yeah.
It's one of those things you don't have to. There are methods out there to get your smile improved on. It's one of those things that employers look at.
Yes.
And customers look at.
Yes. It's a very, very popular benefit these days.
It is. And it's one of those ones that we can do. It's one of the few things we're looking at doing it as a group, particularly because there are, for instance, we've got the child care workers are able to do individual plans on the exchange coming up for no cost.
Right.
And so what we want to do is be able to offer those folks a way to get dental for their people. And there's a way in there that you can do not only the traditional Delta Dental, but they've also got a Delta Cares program.
Right. And that's it's been around for a while. The nifty thing about this particular variant of Delta Dental is they do have, with this group plan, they cover orthodontics to a degree.
Yep. And that is very important for your kids.
Well, and adults want their teeth straightened too.
Correct. That's one of those things out there that get overlooked with, because if you need dental care, you're going to use it.
Exactly. And dental care people don't realize how critical that your oral health can affect your entire physical well-being. I mean, it's a big component to your entire overall health.
Yep.
I mean, there's been lots and lots of situations where someone who had a massive dental infection ended up dead from it because the bacteria got into their bloodstream and caused them, cardiac issues and killed them. And that's still good. No one wants that. Oh, Matt, are you talking to somebody?
Yeah, I am. It's the Delta Dental is one of the most popular dental insurance companies in the United States. They've got the biggest.
Huge. They've got a massive network.
And CAPS came up and said variants sound like a virus and laughed at it. It's like, yeah, today's the first time that we're not talking about COVID.
Yeah. Well, we kind of have. We've touched it, but it's not the biggest deal. We always end up talking about COVID at this point. But for dental health, it's really important, and people don't realize how important it is. Dental and vision. And one thing Delta Dental has actually done is they partnered with VSP, and they're offering a package deal in a couple of their choices. You can not only get a Delta Dental plan, you can also add a vision component to it for a reasonable fee. So that's worth looking at as well if you need glasses. So that's a good thing.
Yeah, that's a great thing. And it's one of those options that we can walk people through. Katz is from the great country of England, and it's got a nationalized health system.
That would be, that's a whole different animal.
That's a whole completely different effort.
Yeah.
So Delta,
I imagine private dental insurance would be a foreign idea.
And let's talk a brief moment about Delta, because Delta is one of those big monster brands.
It is.
And when I say monster brands in the United States, I mean people will say, I need Delta Dental. And it's like, okay, well, we've got, 7?
Something like that.
We've got 7 individualized plans right now with working direct with Delta.
Right.
You can get variants of it through different companies. The Exchange, for example, has a stripped down version. It's a lowish introductory price, but it doesn't cover like the root canals or some of the serious stuff for adults.
It's great for cleanings and basic maintenance of your teeth, cleanings and exams, and they'll also take care of your more basic fillings. But anything above that, it's not covered for adults. It is for kids, but it's not for adults. And that's always, so it's good if you've got teeth like mine. I could be great on a plan like that.
Yeah.
But it isn't appropriate for everybody.
Correct.
So if that's not the right fit for you, that's why we shop off Exchange for options available through Delta Dental directly or.
Well, it's more important we explain what things cover.
Exactly.
Because some people don't realize that. They just look at the brand and say, I want that.
Yeah. Not realizing that even within the brand, there's different options.
Oh, yeah. The one that was set up through ARP was really geared towards folks that are looking at dentures.
That's correct. And it was kind of interesting, which makes sense when you think about it. Because a lot of the people who are looking for Delta Dental through AARP are honestly needing dentures. So that's at least part of that.
That's part of that, and it's probably some of the thoughts that go into that design.
Sure.
Because when you're dealing with these designed programs, you get different things. The one through Costco.
Yes.
A great Washington State company. Is really, I haven't looked at it recently, but the last time we looked at it and described it to the user, they went with an individual plan.
Yeah. Sometimes you're paying a little bit more for the individual plan, but you do have what's I'm looking for?
You have use.
More usability. Yeah. It's a little bit more usable, and it's maybe a little more tailored to a person's needs. And I do like that.
Yeah. There's certain things that they are kind of throwing things down a rat hole.
Yeah, that happens.
We see that in the insurance world when something that's offered is non-standard.
Yeah.
It's kind of why we like the ACA, who's got, they say, hey, these are your benchmarks, what you got to have. Yeah. There's nothing been like that applied to dental coverage.
No, but as Medicare starts looking at dental more closely, we might see a change in that.
Yes.
Because that's one of the things that they were talking about with some of the Medicare updates is adding in a dental benefit.
There's some dental benefits in some of those Advantage plans.
Well, no, I'm just talking about just Medicare A and B, original Medicare. I know there's a conversation about that. We don't know.
The fight has broken out over that one.
Oh, it has. And yes, many Medicare Advantage plans do have some dental benefits, some more than others. And a lot of it hinges on demographics and where you are and which plan you choose. And I can go over it in depth with you at another time. But yeah,
I'm gonna plug the assisters for that. The Medicare experts always use one and ask what your options are.
Yeah.
Just point blank. You could. Susie's awesome. She freaking covers most of the state. However, it's important to have one, and not just a Sheba volunteer, because Sheba volunteers don't really get reimbursements from the insurance companies.
Commissions? Yeah.
Commissions.
No, Sheba volunteers they're volunteers, and they're not, strictly speaking, paid. They get things like some mileage.
They get some mileage through the Office of the Insurance Commissioner. They've got a budget that way.
And they're trained as volunteers, and they're not, their job is to present the options, make sure you understand the enrollment process, but not to help you make a choice.
Correct.
Their job is to facilitate your education. You're educating yourself about these.
And it allows the insurance company to retain any commission kept.
Yeah.
So there's a lack of money that comes back into the community.
Yeah, and that's always no fun. And we want money back in the community. Heck,
we're all we're all about small business. It's like, that's an easy way to support small business.
That's true.
Is always select one.
Because we are small business.
Correct. So there's our plug. But yeah, Medicare's got two different vehicles. We've seen it's with the infrastructure bill that they're talking this fall.
Yes.
Which is anytime.
Which is fighting like crazy.
Which is fine. The one side is, as Suzie mentioned, they'll enwrap it into the B coverage for Medicare.
Which is where currently there is a tiny bit of dental coverage for very, very certain situations. If, for example, you're having, if you're having a kidney transplant, they do dental work for that. Or if you're having, neck or throat surgery, it's included that level. But it's like a very incredibly narrow reason why you would have dental coverage through Medicare B, and it usually has to do with cancer.
And then the other method that they're looking at is a possibility of putting it with the Medicare Advantage.
Requiring them to have it? Because right now it's not required.
It's not required, but it's one of those perks out there.
Right. And a lot of plans do it because it's a sales tab. It's a sales perk. It's a sales incentive. There's the word I was looking for.
Yes.
And that's not a bad thing.
It's a good thing, but that's where, since these plans started in 2003, where the innovation occurs.
Yes.
In the plans, they put it all with the Medicare Advantage plans, because that's a kind of a cheaper way for the government to run healthcare.
It is. It stretches a dollar a little bit farther.
It can lead to a little bit more out of pocket from the consumer.
It does. It follows the health insurance rule. The higher your premium, the lower your potential out of pocket, and vice versa.
Yes.
Your Medicare Advantage plans are usually a less monthly premium than, say, a Medigap plan. But you have the potential for more out of pocket expenses because it's designed like a group plan with copays and out of pocket maximums and things like that. Whereas, say, a Medigap plan, you pay your premium, you pay your Part B deductible, depending on the plan you choose, and then you don't have out-of-pocket expenses for Medicare-approved services for the rest of the year. It's a different animal, but they both, they work in different ways.
Now, what'll be interesting is to see how they incorporate it, because if they go with just the Advantage plans, you're leaving out the folks that are just.
You're leaving out the Medigap folk.
The Medigap folk, which are the old timers and the retirees, because some retiring companies do offer Medigap plans,
which can be a really good deal. So yeah, it would leave them out of that particular loop, which would be a shame. I'm not sure how they could separate the two, frankly. I'm not sure how they would be able to say, okay, well, if you're going to have a Medicare Advantage plan, you have to offer dental. Because the rule is a Medicare Advantage plan has to be as good or better than original Medicare.
Or better.
Which means it has the baseline.
Alexa, mute.
The baseline is the Medicare A and B standard. The $90 emergency room visit, for example. Every Medicare Advantage plan has a $90 emergency room fee because that is the Medicare standard. You can't go lower than that. You can't go higher than that because that's the rule. So it's got to be, and the or better is not necessarily, is maybe having a lower than a 20% co-insurance for some of the benefits.
You forget the primary rule of insurance.
What, make money for the company?
No, the primary rule of insurance is it is governed by laws.
Yeah, that's true.
And so if they say, hey, Medicare Advantage plan, you've got to cover $1,000 dental, they're going to cover $1,000 dental.
Then they're going to have to figure out they're going to have to fight to move the money from other spots. There's going to have to be, it's such a balancing act with these companies, with these plans. You can't, you're always robbing Peter to pay Paul. If you're being forced to pay Paul $1,000, where are you going to find, and you're already, paying Paul $100 that's already budgeted, so you have to find $900 somewhere else. What benefit's going to be, what benefit's going to get reduced because of it? Are you going to have a higher copay for a doctor visit? Are you going to have to pay more for a hospitalization? Is it going to be, are you going to pay more for an MRI? Where's the money going to come from?
You forget the legislators' ability to tell companies to suck it up.
It's not the companies that are going to be sucking it up. It's going to be the enrollees that are going to have to pay it. It's going to ultimately come down to the lowest common denominator. It's because it always rolls downhill.
Well, it's like the.
And I don't hate the idea.
It's like the company that we had a conversation with that was private. Because of their star ratings, they didn't receive enough of a compensation to really ride through COVID on a solid footing. So they had to change some of their pricing structures.
And they do that. That's something that the Advantage companies have to do every year anyway. They have to adjust their pricing structures. And yeah, the better your star ratings with Medicare, the more flexibility you have.
So that brings us to another point. Always do your reviews.
Yeah, it's true. If you are on Medicare and you're hit with a star rating review, do it. Be honest about it. Don't just say, oh, I like my company, I'm going to give them straight 5 stars. Be honest. You want to know why you need to be honest? Because they won't know where they screwed up if you don't tell them.
Correct.
Yep. And star ratings aren't just about your insurance plans. It's also your doctor visits. It's the pharmacy visits. It's pretty much every interaction you have in the healthcare industry. Except for like the agents, we don't have star ratings, but your Medicare drug plans, your Medicare Advantage plans, anything that's got that connection with Medicare and Social Security, the chances for star ratings are there. It's expanding. Every year it expands a little bit differently, and those metrics are tough.
Oh yeah,
they ask really hard questions, and they've got very stringent standards.
Well, the more you're rated, the higher chance that it'll drop down. It's a rule of large numbers.
Yes.
What is more valuable on Amazon? 50-star, 55-star reviews, or a 4-star review with 2,000 reviews.
Exactly, which is it's an average thing. So the more reviews, the more accurate this response is going to be.
Oh yeah, and that's important, and it's going to kind of drive on where health plans take it, because we've got insurance companies, our standard health insurance, like LifeWise, United Health, that are offering these sort of additional components of dental.
And then there's like Ambetter and their vision component. They're out there.
They are out there. What they'll do is they'll go in and they'll usually tie into a network or create a network. I personally, as an agent, I prefer the standalone dental.
I think it's got, in our situation, for what we've got, I think we've got more flexibility with it.
Well, the reason why I do it is you can keep that dental component with Delta and travel across the United States, because we've seen snowbirds do that.
Yeah.
And have access to their dental care across the United States, whereas the insurance companies are kind of tied to that insurance plan. They're looking for a hook for retention.
It's always about retention with these guys.
And I would rather, you look at each component and say, okay, this is good for our family. this is not good for our family.
But when you're doing things on an a la carte basis, sometimes you miss spots too. So that's why bundles created. That's where the Advantage Company comes in. It's the bundle.
Well, yeah, that's the cluster. we do insurance clusters, and I remember looking at retention on the property side, and if you had a car, it was like, oh yeah, you could usually retain someone 2 years without too much effort. If you add the house to it, yeah, you're usually out to 4 years. If you put a life component out there, you're looking at 7 to 8 years for a consumer on average. So you get this. That's why the bundle is so pushed, is for that consumer retention.
Because what happens is if you, it's like, okay, well, I want to move my car insurance. Well, then I have to move my house insurance. Then I have to move my life insurance. And no one ever wants to take all those steps. So they just leave things where they are.
Yeah, they do the set it, forget it.
Yeah.
And, that doesn't necessarily get the best products.
No, and sometimes it works, sometimes it doesn't. I mean, I'm not a big fan. I'm personally am inclined to keep a sharp eye on that kind of stuff, but I also know I'm not average.
True.
Yeah, I'm a little weird. Totally acknowledge that.
Yeah, you've carried a New York Life policy for decades now.
Yeah.
And however, that's a company that specializes in that particular thing.
Exactly.
So
it's kind of hard to beat the price right now.
Well, yeah,
I couldn't get a new life insurance policy if I was underwritten right now. I've just gotten way too.
You buy them when you're young, and we talk life with everybody.
Yeah, get it when you can. Get it when you're young, when the price is right, and it locks in the prices.
Yeah, I think this month we had, I had at least 3 GoFundMes.
For people who had passed away.
People who had passed away or got sick that didn't have a strong insurance component.
Absolutely. And it was a shame. It really was. Young people. And it's a heartbreaker.
Yeah.
It really is.
And so and some of it's like, yeah, I'm sorry, I could give you thoughts and prayers, but I'm not gonna throw money at you for a GoFundMe.
No, not through that. No, there's other ways we can support you, and we will.
And that's So
And as we get older, we're going to see more of our peers pass away.
True.
Yeah, I mean it started. It started a couple of years ago, but
I'm a little bit on the jaded side because my first funeral I remember I was 6.
Well, there you go. Then was it one of your peers?
No, it was my grandma.
That's totally different.
My tiny grandma.
Well, yes. I am talking about our peers, people our age.
Let's see, people my age. First one was, I was 13, 14. Jennifer Womack. Then there was, I was part, that fueled me to become part of the Youth Suicide Prevention Agency. Then I can't remember there was a kid up north that died on a motorcycle accident from my grandparents' house. Met a couple times.
But it's our peers dying of natural causes. That's where things are starting to be. That's where our age is starting to show. I had one of my closest friends in high school about 5 years ago now. He was my first friend who passed away from an organic cause. I mean, I'd had suicides, I'd had accidents. He had cancer. He was the first organic death in my peer group that I was aware of.
Yeah, see, most of mine are...
They're not organic.
No.
You've got one now. We had a friend pass away, was it last week or the week before?
It's been 2 weeks now.
It's been 2 weeks. And so he's one of your first organic deaths.
Yeah. For the most part, yeah,
accident, suicide.
Yeah, it's the typical. If you're under 50, usually it's a physical cause.
Well, guess what? We're not under 50 anymore.
No, we're not.
No, and welcome to the world. And so that's why we're a little jaded about GoFundMes, because we know that how important it is to get something in place for at least final expenses. You know, and I just got contracted with a company they have a final expense option. That's what they do.
Yeah.
So even if you just want something, to slap together that's cheap, I can put together something that'll, stick you in the ground and pay the funeral director.
Yeah. So yeah.
And yes, I'm advertising for myself.
So yeah, dental. Yeah, there are folks out there that are like Suzie who can probably skate by pretty good with, doing their cleanings and paying the dentist directly, cash out of hand.
Yep.
Then there's folks like me. I dare not ever go without dental coverage.
Nope.
Because I could, wake up with, I got a sore tooth and my face is swelling up.
Yes.
I look like a turtle half the weekend.
Yeah, he really did. He had the little beak thing going on.
Yeah.
Kind of like Jennifer Garner, with that little pooched up front lip.
Yeah. I was doing duck face without even trying.
Yeah.
I'm awesome that way.
It was very cute.
So
it was disguised because of the mustache, but it was super cute.
So yes, there are folks out there who need dental insurance. By all means, get it. Yeah. Get something that you can use. We've got a plan out there that starts, the first day of the next month.
Yep.
Without without having waiting periods.
Yeah. There's some plans have some restrictions, and we'll go over every little detail with you. But there's at least one out there that can get you to the dentist on the first of the month and get that root canal taken care of and help it not break the bank.
Yep. So, hey, everyone, have a great week out there.
Yes, enjoy.
It's beautiful blue skies.
It is September.
It is
the
September.
First day of September. Now I'm going to stop because otherwise I'm going to run into
trademark infringement. All right.
Infringement. So
bye-bye
Have a
for
good
next
one.
week.
Thanks for joining us. Bye.
Bye.